Hey, hello, my name is Eva Fath. Today I'm going to be presenting on the impairment of the lower back arching, specifically within the overhead squat. So to begin, the overhead squat that we're going to be looking at today is a traditional movement assessment that specifically impacts the LPHC, or the lumbopelvic hip complex. This impairment specifically impacts the body by decreasing hip extension, shoulder flexion, as well as hip internal rotation. The LPC issue specifically can alter force couple relationships within the body, as well as joint arthrokinematics. So this YouTube video, which I'm just going to slide over here, displays that lateral view of the arching of the back. So I'm going to go ahead and play this because you can really see the arching of the lower back within the overhead squat assessment, specifically from the lateral view. Can't see it as well as the anterior and posterior view, but you'll see as she goes down, you can kind of see from the lateral view she has a little bit of knee valgus as well, and her feet might be flattening a little bit of pronation going on there. But these overactive muscles within the impairment is specifically the latissimus dorsi, as well as the hip flexor complex, and the underactive muscles are the gluteus maximus as well as the intrinsic core stabilizers. So that is the impairment that we will be looking at. And so how to fix that impairment, we're going to use the corrective exercise continuum. So the first phase consisted of the inhibitory phase, which was the self-myofascial release. We did the foam rolling on the latissimus dorsi specifically, so I'll go ahead and play that video. This is going to kind of release the tension and get those overactive muscles a little bit more relaxed. And so the second phase that we're moving on to is the lengthening phase, which was the static stretch on the latissimus dorsi. So this was holding that static stretch for 30 seconds or so on both sides. Also, you want to make sure that you're including both sides of your lats because they attach at your humerus, and you want to make sure that you're getting the same type of stretches on both sides, because that could cause muscle imbalances and stuff. So you're going to hold that for 30 seconds, which I'll go ahead and show you. This wasn't quite 30 seconds, but you get the idea. And you also can do this on a medicine ball, but I didn't have access to a medicine ball. You'll see I also did some different things. But so moving on to the activation phase, this was consisted of the positional isometrics on the gluteus maximus. So the lengthening phase was to kind of increase the range of motion, and this activation phase is to increase those underactive muscles, which is the gluteus maximus. So you're going to see here that I kind of did the glute bridges, but I didn't have access to a medicine ball again, so I used a chair to support my scapulas and the upper extremities a little bit. And so I just did that to get those glute max and the core stabilizers a little bit more activated. So then moving on to the last step, which was the integration phase. This consists of the wall ball squat with the overhead press. So didn't have access to great weights, but you got to use what you got to use. So I had this barbell type of thing. And then the ball that was behind my back was just a towel wrapped up. It worked fine, but obviously medicine ball would work better. But you can kind of see that this integration phase is going to retrain those synergist muscles. So specifically in the lower back, which could be the levator scapulae or the erector spinae. So you're going to see that I'm doing these dynamic movements against the wall with the ball behind my back, kind of about my lumbopelvic hip complex. And so that there is the impairment of the lower back arching within the overhead squat.